Hello, my name is Paul Batalden. I'd like to invite you to think together with me about the construction of a change for the improvement of healthcare and what's involved in studying that process of constructing a change. I believe that making and studying improvement of healthcare are different kinds of activities. So how might we better understand them? How might we use that understanding to advance our systematic efforts to improve healthcare? Well, I think it begins by recognizing that they involve different questions. Making and studying involve different kinds of questions that we're seeking to address. With respect to making a change, we're interested in what can we expect with situations and phenomena like this? How might our situation bear on the change that we're about to make? What are some of our assumptions and hunches about the way that this might work? What actually is the process? How might the process of change actually work? If we're going to make this kind of a change here, what's the planning that's actually involved? What kind of cooperation will be required? Are there preparations that we need to be sure to include? What kind of observations should we be prepared to make, and how will we make note of them? As we go along, it's helpful to record the adaptations that were required. You started out to do something, but then you encountered a situation that you needed to sort of address, and you adapted the process and the plan that you had in mind to make the change. And as you now reflect back over the overall sequence of things, what jumps out at you? What are your reflections as you think about making a change? So the questions involved in making a change I think, different than the questions that are involved in making a study or studying this change-making. Here, I think we're interested in the adequacy of the literature review. Did you really conduct a good literature review about this kind of change-making? Did you include the experience of others in your designs? What of the available study methods to study the change, which one was selected? What was our rationale? What about the setting and what about the context was relevant? Is there information or data about the process of making the change and the results? How was the data collected, and did it occur that way? What analyses were undertaken when thinking about the improvement and the change effort that was aimed at making improvement? What interpretations are we making of the analyses? What are the inferences that we're making? And what are the limitations of our understanding about change making? At the University of Leiden in the Netherlands, Jan van den Broek, a student of clinical trials, has said that science proceeds by careful assessments and studies of the effectiveness of interventions. And as he notes, the hierarchy of the various methods are well known to us, with the randomized control trial functioning as a powerful, perhaps the most powerful way to conduct effectiveness and assessment studies, and a well-described case report less powerful as a method. But when it comes to the other part of science, discovery and explanation, he suggests that this order, or this hierarchy, is actually flipped on its head, and a well-described case report can help us understand or discover things that we might not be able to see or discover in a randomized controlled trial. Well, let's push into making a change for improvement using generalizable science. Here, I think we bring together several different ways of knowing about things. The first has to do with this generalizable scientific knowledge. This element combines with particular context in a process of making things happen that results in measurable performance improvement. Let's examine each of these elements a little more clearly. First, the generalizable scientific knowledge. We build that knowledge by controlling context out as a variable. When that knowledge is built, it's kind of dead on arrival. It lives in hard drives or journals or some other data storage vehicle, and we extract that from that storage in order to apply it and use it. And as we get ready to use it, we want to try to understand the context into which we're trying to make that application. When we build knowledge of the context, we don't control context out as a variable. We obsess about the context. We want to understand everything we can about the context, the processes, the systems, the habits, the traditions, the things people talk about, the things they celebrate, the things they don't talk about. We want to understand that context so that we can design the right kind of hookup between that generalizable scientific knowledge and this particular context. And we do so with an understanding that we're going to be able to measure what happens. And so this kind of measurement knowledge is not sort of a new system of numbers, but rather an obligatory attention to time or measurement over time. And often the measures we need are not available, so we have to create them. So we have this challenge of faithfully creating measures that reflect the underlying thing we're trying to understand. But it's not just these three sets of words that represent the knowledge systems. There's also a knowledge system represented by the plus sign. This is the plan for making the hookup. And there's knowledge about various types of hookups or plans to bring about the connection of this knowledge in this particular context. And then the arrow or the phenomena of execution and in this particular setting. And how will we go about actually making the change that we've constructed? Change in a complex social setting involves hunches and theories that lie underneath the interventions. And these effects that we achieve are achieved by individuals and groups of individuals who in fact are focused on achieving a desired result. The effects and the success of these interventions rests on a sequence of steps in some kind of a chain of implementation, and these chains are non-linear in the way that they work. They're recursive. They recycle them on themselves. And the implementation and the change in complex social settings involves multiple social systems, and therefore it's fundamentally fragile as we try to undertake a change and have to pay attention to the neighboring systems. The intervention is usually locally adapted as it's delivered and refined and reinvented in that particular setting. And this process of feedback in open systems involves feedback on both the intervention and on the context in which that intervention is being introduced. So making a change involves bringing a lot of knowledge together and holding it together in an effort to make a change. Studying the change making, I think, involves a different mindset. Here we make an object out of this collection of knowledge systems because we want to understand how they work together and how they influence each other and how good each of them are and what their validity might be and what benchmarks are available for our consideration, and how is the overall value and effectiveness and synthesis best understood of the way in which these knowledge systems have worked and come together. Often it's more than just a single kind of change effort. There are multiple change-making efforts done for the purpose of a whole organization or a whole setting in which the change is undertaken. Here we want to understand the connections between the individual change, the discrete change activities, and the whole. Here we want to understand the beliefs and assumptions and observations that folks have made, and we want to understand the learning environment in which this change making has actually occurred, and what the contribution of this collection of changes has been to the social need, to the overall organizational aim, and to the benefits of the particular beneficiaries who are in a position to receive the benefit of this collection of changes. The knowledge we build can be represented this way. If the black rectangle is what there is to know, the blue circle is what I now know, and the red ring around the circle is the zone of inquiry, what I don't know and have questions about. As the knowledge about improving healthcare grows, we see the growth in the blue circle, what I know, but what we also see is the growth of the circumference around that circle. So the zone of our inquiry and what we have questions about has also grown. It's recognizing that this is the way in which we go about building knowledge for improving healthcare. Because if we systematically make change and study the way we make it and do it, we together can contribute to the development and advancement of this emerging science, art, pedagogy, and practice of improving healthcare. Thank you very much.